I'd like to welcome everybody to the Medical Marijuana and Wellness webinar series. Tonight's topic will be anxiety, stress, and medical marijuana, a topic that is very popular, especially in the cannabis world, but unfortunately is a condition that's the popularity is something that stresses out a lot of people, gets them very anxious, and creates a lot of tension in the world. So tonight we're going to talk about how cannabis can help with that particular condition. I'd like to welcome a gentleman that I've done a couple webinars with, and somebody who is teaching me how to play golf. Zach, tell us a little bit about you and what you do.
Yeah, thanks, Mark. Hi, everyone. My name is Zach Franckhauser. Currently, I am a community educator for Trulieve here in Jacksonville. What that means is I go around working with physicians and their clinic staff, educating them on the products that we offer and how cannabis can help with some of their patients. I've been with Trulieve since 2016, started in our original dispensary in Tallahassee, and have enjoyed my way, these last few years and seeing the growth that has come out of everything. So thank you again for having me, Mark. Looking forward
Zach,
to
you've done a lot. You've done a lot of training. You do a lot of training, especially with doctors on the subject of medical marijuana. And I'm sure that the topic of anxiety and stress comes up quite a bit.
Absolutely. And we see that the Board of Osteopathic Medicine provides a nice report on, all the conditions that were registered this previous year and in years past. And anxiety is certainly if it's not the most used condition, it is one of the, top three at least. So it is by far one of the ones that comes up most often, especially this past year, 2 years with COVID. I think a lot of people are becoming more stressed, heightened anxiety, and it goes hand in hand, as we'll see here.
Sure. It's really interesting. Well, listen, I'm going to put up some slides because I think it gives us a chance to talk about this particular topic. So let me put that up. There we go. And I want to point out that the reason that we do these webinars is really to provide information to you, the user, about this particular topic, and also to answer your questions. Please feel free to answer your questions. If you look down, you'll see a little double Q&A button. Put your question in there. We'll be more than happy to answer it. We're going to be answering questions. We have this webinar broken into 3 segments. And so we'll be answering questions at 3 different places, as well as during the webinar itself. And so hopefully we can get your question out there. There is no such thing as a dumb or a bad question. We're here to answer questions, and I know don't be shy. That's what we're trying to do. We're trying to educate as well as communicate what cannabis is all about. Tonight's webinar will in fact be is being broadcast on Facebook, so you'll be able to check it out there. I do also want to point out that we do have other seminars that are coming up. If you look over here, you'll see that there's webinars coming up. Next week, we'll be doing one on cooking, which is interesting. That's a new one that we've done. Plus, we're going to be talking about dosing, terpenes, and a number of other webinars that are there. So please join us. And our moderators, of course, will be helping us in each of these different areas. I do have to say I'm excited about next week's webinar as well, because we have Sarah Sicard, who is the Martha Stewart of cannabis, so cannabis cooking. So we'll see how that works out. But we have this week, we're talking about stress and anxiety, and we've got a pretty good agenda planned. I do also want to point out that, again, we talked about the Q&A button, something that you may want to take a look at, and please let us know what's there. You'll also, at the end of this webinar, for following up, we will take the video, we're going to post it on YouTube, and then we'll send you out a email that you'll be able to look at. You'll be able to click on it and watch the webinar again, or pass it on to a friend. You get a copy of all the slides, so you don't have to take copious notes. You'll be able to get the slides in a flip book format. Any sponsor discounts, Zach has a few to pass on, and then also information on the speaker information and some of the resources we use to be able to put together this webinar. So you'll be getting some good follow-up after this particular webinar. Now, I do want to take just a moment, and I want to say that we have dedicated this webinar series this particular quarter to a lady by the name of Jennifer Perdomo. And for those of you that's seen our webinars in the past, or you followed some of our cancer or our webinars on things like neuropathic pain, she was very active in that. And unfortunately, we lost her to cancer a month or 2 ago, and she was a very impressive educator in cannabis. And as an educator myself, I just wanted to respect that what she did, really remember her and dedicate this webinar series to her. I know she's been very active in the community. She was called Miss Miami Cannabis and somebody that was dearly missed. Zach, any comments on Jennifer?
Uh, Endless comments, truthfully. Really don't know where to start. Just an amazing human being, amazing person, mom, friend, coworker. She was someone who certainly, when we talk about advocating for cannabis, she was certainly someone on the forefront and always wanted to be, again, Miss Miami, Miss Cannabis Miami. I think it speaks volumes about what she put into her job here in Florida. And, I only hope to be able to pass the baton on and carry on her legacy and continue to, shine her light. So thank you very much for having this, actually.
Yeah, well, we want to respect for. So let's talk about anxiety and stress. I know that especially in these times, it's been on the rise. A lot of people say, well, what is this? Well, what's interesting is stress. We see here is really stress is a physical or mental response to an external source, meaning you're stressed over something. We'll talk about what some of those somethings can be, but stress is something that we live with in our life quite a bit. And the correlation, the partner to that is anxiety, which is really it's something that's ongoing, and it's a response to stress. So they're kind of tied hand in hand to what's out there. I put the slide up because, first of all, it's important to understand the difference between the two. But I think the other is that if you have anxiety and if you have stress, you're not alone. I mean, if you take a look at the numbers that are down here, you have 264 million people worldwide with anxiety and stress. But here in the United States, and these are pre-COVID numbers, you have 31% of the adult population will experience anxiety and stress over a lifetime. That's a third of the population. That's over 100 million people here in the United States. So if you have, or you're feeling you're anxious, you are stressed, you're not alone. Let's put it that way. That is, I would say it's something that can be identified. It's something that can be addressed, but it's something that definitely is out there. And you can see that when you begin to feel overwhelmed by that, it becomes almost it gets you into a number of different reactions to that. And I just want you to feel comfortable that you're not alone, and that's what we want to talk about today. Zach, any comments on that?
No, I mean, I'm pretty sure you hit on everything there. Stress and anxiety are certainly, again, two of the most prevalent conditions that we see here in the Florida market. And, cannabis has been shown to be very effective in treating some of the disorders, especially some of the different types of anxiety that are available, especially with, higher doses of CBD, especially being that CBD is anxiolytic. We'll get into that in a little bit.
Yeah, I know that, if you take a look at what we're seeing in the stress area, we use an example of just paying an electric bill, just getting the money to do that. I know that jobs, just take that as here in this COVID environment, having one, finding one, keeping one, making sure that there are resources that are there. That's always a big stressor that for a lot of people that are out there. And, and you can get very anxious, over that whole thing. And the anxiety is something that can really lead to a lot of different medical conditions that really aren't really good for you, and get you into some depressive states, and really doesn't make it very fun. You've probably seen a little bit of that in some of the customers you deal with.
Absolutely. Customers always coming to us regarding stress about their job, daily lives. I mean, life in general is stressful, if we're being honest. So, having something that you can lean back on, it's a healthy alternative. It's not, some people will use a glass of wine. Alcohol is not going to necessarily inhibit a lot of things that cannabis will not necessarily inhibit things that alcohol can sometimes. So many people are starting to use this as an alternative, especially those that, again, are seeking a healthier alternative too.
Sure. I mean, it's not abnormal. And especially in this time, I'd say that number is well above 31% right now. It's pretty safe to say.
I certainly agree.
Well, the question is there research on this subject? And interestingly enough, there is a lot of research on stress, anxiety, and cannabis. Fortunately or unfortunately, because here in the United States, cannabis is a Schedule I drug, there's really not any research being done per se. Most of the research, in fact, almost all the research that's being done is being done overseas. It's being done in Israel, it's being done in England, Spain, Germany, a number of different places. Canada, for example, is very big in the research part. We do some studies here in the United States, And a lot of those studies are what we call anecdotal, meaning we're not studying the plant itself. What we're doing is we're taking a group of patients and we're getting their feedback on this particular subject. So there is some anecdotal studies that are out there. But what we have found in the studies that are there is the endocannabinoid system, which is a system we have in our body. It's parallel to our nervous system, is very important to being able to regulate anxiety, stress, your fear that's out there, as well as things like your appetite and your mood. And it was also found that a lot of patients who suffer from PTS or chronic pain do have a lot of anxiety that's out there. I know that especially when I fall in the chronic pain category, not being able to do certain things and not being able to have my body function like it did before due to an injury, it's stressful, and you get a little bit anxious doing that. And what they have been able to find out, not only does cannabis help with this, but there's a lot of terpenes, and we'll be talking about terpenes later on. It's part of the cannabis plant, also very important to help with stress, and they've been shown to be very, very effective. And there's been a new study that came out in 2020, and it was published, and it basically shows that an endocannabinoid, which is called 2-AG, which we'll talk about, part of what I call the dynamic duo of cannabinoids. It helps to activate THC, which helps quite a bit to reduce anxiety in a lot of patients that are out there. So there is studies that are out there. There is science that's behind this. It's not something that it's a couple kids in the street trying to figure out what's going on. There's a lot of doctors today I know that are suggesting this. I have one of my neighbors who his doctor actually told him to go get medical cannabis. That's how he called me to help him with his stress and anxiety. So it's something that is becoming, I wouldn't say popular with the medical profession, but I would say it's clearly there. They're paying attention to it.
Certainly seeing a lot more veterans kind of gear their way towards cannabis recently, especially having PTSD. Even some of the VA providers have actually been telling a few of their patients that, hey, this could be something to consider. Mm-hmm. I work with a few veterans myself who all have great things to say about their cannabis use and how it's helped them, especially get past a lot of the things that they dealt with,
right.
While overseas. And, while cannabis may not have a lot of studies on it per se that are, considered clinical and here in the US, but terpenes, there are actually quite a number of studies on those, and you can actually take a few of those terpenes and really find out which ones will help you become more relaxed and really get rid of those anxiety problems.
Sure. Yeah. And again, you'll be getting at the end of this, you'll see a lot of resources that we have, a lot of research. If you want to really dive down into it, we'll provide you the capability to do that. But this is something that's been well researched, and not only from the standpoint of research, but we have thousands of years of people that have used cannabis for their anxiety and stress. So we'll leave the anecdotal stuff to itself. So how does CBD and THC relate to this? Well, it's interesting that when you have THC, which basically is the component in cannabis that provides the psychotropic effects, in low doses of THC, it actually relaxes you. It eases anxiety, and it's very effective in treating or addressing anxiety and stress. In high doses, it has the potential to worsen it. So THC is kind of a two-edged sword, this is where it gets into the dosing, which we'll talk about in this webinar as well. The dosing is very, very important to make sure you have enough THC to get that relaxing anxiety, reduce the anxiety and stress, get that effect from THC, but not so much that it crosses that border and makes you anxious that's out there. High doses of CBD, how interestingly enough, do appear to reduce anxiety. And that's what they've been able to find through the research and through the anecdotal studies that are out there. You've seen a little bit about that, haven't you, Zach?
Yeah, absolutely. One thing I always recommend to my physicians for those patients that are dealing with anxiety and stress is our 8-to-1 nano tincture, high CBD product. So it's going to provide, one, being that it's nano, great bioavailability. The efficacy is on it has greatly increased, so you can use smaller doses to really get the same benefits. And THC, that's oftentimes why we tell patients with anxiety, not really to go towards those concentrates. A lot of those are going to be high potency and can oftentimes, especially if you're not a frequent user, can definitely worsen the anxiety and make things a little bit less pleasant than what you were hoping for.
Right. Right.
You can
So,
always
I
use
mean,
CBD, of course, to mitigate those effects.
sure. So we have evidence that THC and CBD do help. Really becomes down to a dosing question, which we're going to address later. But we have some efficacy in this particular area for cannabis working. Now, one of the questions, and by the way, please feel free to answer your questions. We're here to be able to do that. We have a couple questions that have come in, but please feel free to let us know your questions that you might have. So there are a lot of what I call anti-anxiety medications that are out there, and you'll see them, the dopamine, the serotonins, the I can't hardly pronounce that word. You have a lot of things that are there. The question is, what does cannabis get in the way of that? Does it interact with it? What do you have to be careful of? And fundamentally, cannabis really doesn't get in the way of most medications. What you have to be careful of is any medications that have to do with blood pressure and elevating the heart rate, because when you take THC or you take CBD, it can elevate the heart rate a little bit. And what you want to do, especially if you're having heart problems, you want to be able to keep that in check. Now, does that mean that you can't use cannabis if you have that particular condition? The answer is no. Okay, there's a lot of patients who do. In fact, it is recommended by a lot of doctors to get on a cannabis regime to help lower the blood pressure, to lower the weight, and other things that are out there. But it's important that you pay attention to the dosing. How much do you use? And getting your medical doctor, working with your cannabis doctor or your cannabis practitioner to really get a dosing regime that really helps you be able to get in the proper there. Zach, do you have any comments on that from a Trulieve standpoint?
No, I mean, I think you hit on all of that, Mark. I mean, to the person with the question in the chat, absolutely talk to your physician about some of the medication that you are taking, and let them know about your cannabis use. Hopefully they're there to help you. And if, you feel that cannabis is helping you and they're telling you differently, that is completely up to you at that point, of course, but definitely speak with your providers and, be open with them so they can help you.
Right. I think that's really, you just hit on something that's really important. If you have a condition like that, and I think Rita, you are going to ask a question, and we're going to answer your question in just a minute about the fact you're taking RSO and you're talking to your cardiologist. Let him know that you're taking, please let him know. Okay. It's because he can help actually adjust your pharma medication for the cannabis regime that's out there. And your medical marijuana doctor can help you with that as well. And I think one is, yes, let your doctor know. And I think the other thing is, in that particular case, what you want to do is you really want to go low and go slow. Start with a little bit of RSO. Don't take the whole eyedropper full. I don't know how you're taking it, if you're taking a syringe or what, but what you want to do is you want to go low and go slow to find out what the reaction that you have, to find out how your body reacts to that, because cannabis, much like alcohol, is very individual. It really depends on you, your metabolism, and how you react to it. And it's important that you find out about that. And I'm not going to get into dosing right now. We have a whole slide on that, but we'll be talking about that later. But it's something that we'll bookmark that, because that's part of the solution that you're going to look at, is part of the dosing that's out there. And by all means, Rita, please let him know what you're doing. You'll be surprised how many of these doctors today understand that their patients are taking cannabis for a number of reasons, and do have programs and protocols for that.
Most of them are also already aware too.
Yeah, it's you're not going to surprise him. Let's put it that way. I'd be shocked if he was surprised that's out there. Now, what we hear about cannabis, and they talk about cannabis is made up of cannabinoids, and so the question is, what do cannabinoids do? Well, each of these little underlined blue lines are studies and research that we've identified with different conditions, and they've been gone out, and there's been probably there's a tremendous amount of research that's been done on cannabis. Now, when you hear the politicians, they keep saying, well, there's no research. And I'm the first person to tell you, I think we do need more research for a number of different reasons. But to say it's not been researched is not true. If you take a look at PubMed, which is where our doctors, where the research community places research studies into this PubMed, which is the National Institute of Health's database, this is where you find studies. One of the most studied, one of the most biggest studies that are out there is on medical marijuana. In fact, it's 3 to 4 times more studied than almost all the pharma drugs that are out there. The problem with that is all the studies are not done in the United States. They're done, again, outside the United States and being able to put in there. But there is a lot of scientific evidence that are there, a lot of anecdotal evidence, research and anecdotal evidence that you'll find. And I want people to feel comfortable that cannabis is entering a phase where, as we're doing more research and we're learning more about it, I think we need to be very frank that there is research and we need to do more here in the United States. We need to really take the gloves off. I don't know why we're stopping people from feeling better, but we really need to start addressing what the people need and really trying to look at this particular option that we have. Lee, you have a poll that's here, and I'm gonna go through this later. I want to finish the presentation. I'll go through this when we do the. I'll do this when we go through the slides on when we go through on the slides on some of the question Q&A pieces that are out there. But what I do want to go back to my slide on cannabinoids. That it's very well researched, and I want people to feel comfortable about that particular area. Now, the other thing that's important is we know that there's 200 cannabinoids in cannabis. That's why it's why our medical community, the Western medical community, has so much difficulty with it, because our system out here wants to study one component, one cannabinoid, one dosing method for one treatment that's out there. And the interesting thing about cannabis is that when you get CBD and THC working together, it's more effective than just by themselves. So 1 and 1 is 3. We call that the entourage effect. And so it's very hard. It goes against the principle of what they're studying, but we do know that the effect is clearly there. And we can see that by a lot of anecdotal studies that are there. So hopefully our method of researching looks at the results as opposed to just one individual component, and tries to understand that 1 and 1 is 3 in a lot of these particular things, especially with the holistic medicine. But more importantly, you as an individual, you and I as a human being, we produce what they call endocannabinoids. These are endogenous cannabinoids that we make. You're in essence a marijuana plant is the best way of putting it. And this is how your body regulates itself. This is how your body puts you in a state called homeostasis. Now, what's interesting about cannabis is there's things called phytocannabinoids, and these are exogenous cannabinoids. What that means is that they're made by the plant, and they're almost identical. What's interesting is how the phytocannabinoids and the endocannabinoids work together. They work like lock and key to be able to help your body regulate itself and really treat itself and really heal yourself and address a lot of those medical conditions that we saw earlier that you see that's up there. And this is all done through a number of what we call endocannabinoid receptors. We'll be talking a little bit about that and how it all works. But I think it's important to understand that this is a very natural process. We're not putting foreign substances in our body. The phytocannabinoids pretty much are lock and key. It's what your body needs, in fact, in many cases, to be able to get the resources to charge its battery to be able to address what's out there. Comments on that, Zach?
I will say definitely with the fact that there are over 200 cannabinoids, it certainly comes into play sometimes on the research aspect of things, and why many people can't necessarily, really give you a full truth on why cannabis helps for certain things. As we know and we've seen, everybody is equipped with our ECS or your endocannabinoid system, which is serving as a regulatory buffer for any of your emotional responses. You see it on all parts of the brain region where different receptors are available for these phytocannabinoids to work with them. But as we continue on, throughout our journey in the cannabis world, we'll start to see more research out there that absolutely helps identify which of these cannabinoids is specifically helping with each condition.
And I think the other thing I wanted to point out here is, I know, especially folks that are new to cannabis and some that have been around cannabis for a while, where do you find those cannabinoids? And those are called the trichomes. If you look at the cannabis plant itself, that little tip over here, they looks like little snowy pieces, like little ice cubes that are sitting out there. This is where the trichomes, this is what it's all about. This is what cannabis production is all about, is the cannabis plant. I know when my mother got into medical cannabis, she was saying, how come all the plants look real funny? And I said, that's because they're basically showing you the part of the plant that's providing the medicine that you need. But the trichomes are like hair-like little structures that you find on the cannabis plant that you see down here. And that's a little bit about how it all goes together.
Yeah, they all contain a lot of the terpenes involved.
And the terpenes that are there. Yeah, we'll be talking about those as well. And so there are 200 cannabinoids that have been identified. In fact, they're identifying so many that I was talking to a researcher, and he said there'll probably be between 250 to 270 cannabinoids identified by the end of the year. The problem is they haven't been studied. They're just getting down, since our research has been lagging. We're really just studying a lot of these cannabinoids now. And the main cannabinoids that have been studied are the ones you just see up here: the THCs, the THCAs, CBDs, the CBDAs, THCVs, that type of thing. We'll talk a little bit about these later on in the presentation, but these are the main cannabinoids that have been studied that we know about. A lot of the others that we don't know about, we're not going to talk much about them because we don't know much about them. But I just want you to know that they're there, and they have some reasoning, and we're finding more and more about each of these. In fact, we're finding out that CBN, the one you see here in the middle, has become so prevalent that there's what they call major and minor cannabinoids. The major cannabinoids being THC and CBD. They're actually looking at elevating CBN to make that a major cannabinoid as well. It's because of what it does and what they're finding. It wasn't researched as much as the first two, but as they're doing the research, they're finding the effect that it has and how predominant that it is, and it is a major cannabinoid that's out there. So don't be surprised if you see we go from 2 to 3 major cannabinoids in the short term over the next year or so.
Absolutely. CBN's just converted THC, so it's surprising.
Yeah,
nobody really knew about it.
Yeah. So and it has something that's called the entourage effect. And what does that mean? That means that it works together. For example, if you take THC by itself, especially high concentrations of it, what it does is it'll get you to a position where you get a psychoactive, psychotropic effect. You get high. If you take some CBD with it, what it does is it lessens the effect of that high. Doesn't lessen the effect of the medical benefit of THC. All it does is just calm the high down. In fact, in a lot of the clinics that I work with, and in my practice, my medical cannabis practice, I actually recommend patients to get a bottle of CBD and have that available to them. Because if you're doing the dosing, you're trying to figure out what your level is. You might take a little bit too much THC and get a little bit high. And if you don't want to have that effect, you can take CBD, and literally within 20 minutes, it'll bring you back down to where you were before. So it's very important. It's a very important component that's out there. And this is, again, the entourage effect, where they work together. But working together, they also, tying the terpenes in there, you'll find that it all works together to increase the medical benefits. That, for example, CBN's been known for sleep, and that's really helped there. And we also found out that THC and CBD enhance the benefits of CBN, which is why they lost CBN in the studies. In fact, CBN was actually doing a lot of the work rather than THC, and so that's what they're finding out now, is that that's how important it is. The entourage effect is important from another couple different perspectives. Zach, what do you think?
The entourage is absolutely, one of the most researched effects from cannabis. When Meshalam came out regarding the entourage effect and how cannabinoids and terpenes, flavonoids all worked with our ECS, it was really encouraged that you should be using whole plant products such as flower, RSO, other products that are full spectrum that provide, each of the different cannabinoids, because each of these cannabinoids provide different medicinal effects and benefits. And as you pointed out, CBN, after oxidation, it can increase the effects of THC, CBD, CBN. Actually, when you smoke it, you're technically decarboxylating it right then, and it is turning into CBN, which is what you're inhaling. So as that research continues, we'll certainly see that the entourage effect is one of the main players in why we consider cannabis to have such great benefits.
Right. And then not only are the cannabinoids important, but also the terpenes, which we'll talk about, and the flavonoids are really important. It's all working together. They really help quite a bit. And we'll talk a little bit about terpenes, and we'll talk a little bit about strains and cultivars, and a little bit about how this all works. We're not trying to confuse you. I'm just trying to demystify it for you. Let's put it that way. So if we're using some terms, relax. We'll clarify those for you and make it a lot simpler for you. But also, the entourage effect has another effect, and that is, I've had a patient that was taking it for arthritis, and it was a terrible case of arthritis where she really couldn't hold a remote control, nor could she eat with a knife, fork, and spoon. So she hadn't eaten at a restaurant for 2 years. She didn't want to be embarrassed. We put her on a regime for medical cannabis, and her hand actually loosened up to the point where she could use the remote control. She could, in fact, hold knife, fork, and spoon, and she started knitting again, which was really interesting. This thing. So she's playing golf. She's a senior citizen. So She's in her 80s. So I find it very, very interesting that Nana is an example of where cannabis saw that she had a problem, but it also, she had a problem with her shoulder. She had pain in her shoulder, and her pain in her shoulder went away. And she said, Mark, taking it for arthritis, but my pain in my shoulder went away. And I said, Nana, your body knows you have a problem. You don't need a doctor to tell your body where your problem is. Your body knows. And as you're getting it enough endocannabinoids in there, as endocannabinoids are getting, the photocannabinoids are boosting the endocannabinoids. What's happening is you're getting enough medication in your body to treat other things besides the arthritis. So the entourage effect will help you address more than one condition that your body might have that's out there.
Absolutely. And there's, I don't think it's coincidence on why the U.S. government has a patent on THC, CBD, and CBN, a few other cannabinoids too.
That is an excellent point. On one side, they tell you it has no medicinal value, and then on the other side, they go through a very lengthy and expensive process to get a patent on a lot of that. So
yeah.
Interesting. We definitely need to pull everything together and get us all on one page. Now, we talk about THC and we talk about CBD and how exactly does it work? Well, THC, for example, addresses the CB1 and CB2 receptors. And later on in the presentation, if you want to see how this all works, we talk about the receptors, the endocannabinoid system, and we go in depth on that. But just know that CBD treats both of those. So does CBD. I'm sorry, THC does, and so does CBD. CBD addresses the CB1 and CB2 receptors. But the nice part about CBD is it not only addresses those receptors, there's a number of other receptors in the body that it also addresses. And so what's interesting is this is where a lot of the other effects that come into play, and I have a slide on this later on in the deck that show the different receptors besides CB1 and CB2 that are being addressed by CBD. So it has a lot of medicinal benefits, and that's what we're finding out. And it's so many medicinal benefits that the studies are getting more and more evidence of what's going on. They're reinforcing what we knew in the past, but they're also breaking new barriers about how this is helping a lot of people that are out there. Now, the other part with cannabis is called the terpenes. And what are terpenes? So the plant has terpenes that are coated, and terpenes help for a couple things. It helps the plant ward off bugs that want to eat it. It helps with it protect it against the sun and for the elements that are there. It's very much like essential oils. In fact, they are the essential oils of cannabis, and they do have odors and scents. And that's where when they see people say, I can smell the plant itself and I can smell what's there. What they're really smelling is not the cannabinoids, but the terpenes that are out there. Zach, you want to chime in on terpenes a little bit?
Yeah, absolutely. Many people often ask why do certain strains provide certain effects and benefits and reliefs, and why does it cause anxiety? Why is it, having the opposite effects on what I had last time? And to answer that in short is really a lot of these terpenes that you're finding involved. Terpenes such as limonene, very citrusy, fruity, found in a lot of different fruits, as you can imagine, as the name pretty much hints to. It is known to elevate mood. It's known to relieve stress. You find it in a lot more of these fruity strains, especially more of the earthy strains as well. Pinene being something else naturally found in pine needles, natural bronchodilator, helps open up the airways, can oftentimes be a distressor. So, it's no secret why some people will use these as essential oils, such as linalool. If you look, a lot of masseuses actually use linalool because of the fact that it does have all of the anxiolytic properties. It allows for relaxation. It's anti-inflammatory as well, analgesic. So these terpenes are not to be misunderstood and not to be overlooked either. They're certainly something that provide a lot more benefits to the plant, and hand in hand with THC and CBD. Of course, THC, CBD have their own benefits in themselves. Terpenes really just elevate those a lot more.
Yeah, it's like 1 and 1 is 3. And what's fascinating is by combining terpenes with the cannabinoids, you can have different effects that are out there. And that's what's happening now. We'll talk a little bit later about what they call cultivars versus strains. And so, for example, there's products I've seen on the market that came out when I had my knee operation. I was taking a very high a high THC product for the pain. And it would really help quite a bit with pain relief, but obviously because it was doing that, it was very energetic. And then I found out about 6 months later, they came out with the same product, but it was for sleep. And I thought, that's kind of interesting because that product wasn't putting me to sleep. And when I looked at and I talked to them about what the difference was a high level of myrcene.
Mhm.
And by taking that same cannabinoid and being able to increase by being able to grow a plant that had a higher concentration of myrcene in it, you now have a product that can help you sleep. It gets rid of the anxiety and stress and helps you sleep. And so they've been able to engineer these plants, right, by genetically, just like you grow roses for different things. They're now growing cannabinoids or cannabis plants to be able to address different medical conditions. And a lot of the difference between them is not just the cannabinoids, but a lot of it is the terpenes and the amount of terpenes and flavonoids that you find that are in there. So this is where the 1 and 1 is 3 that's going on. I don't want to confuse people, but that's what a lot of folks like Trulieve are looking at, is how do I provide a product that addresses a particular medical benefit?
Absolutely. I think you'll see that more so. And as you mentioned, our cultivar collection, really finding specific strains and the terpenes inside of those strains for specific medical conditions, and how, these specific strains later we can say, hey, this strain here is great for, back pain, arthritis, whichever it may be. And it's just finding those combinations of, a little bit more myrcene might, make you a little bit more relaxed, tired, lethargic. A little bit more pinene might actually, increase the anxiety sometimes. So, there's certainly multiple different ways to go about finding those certain strains. And, there's always benefits of using our lab reports. Using those lab reports, you're then able to find out what terpenes are in that strain that may or may not have helped you. So then next time you go to the dispensary, you can certainly look to find the strains that, would benefit you more.
Yeah, we have a question on that, and we'll address that when we get to the question and answers in the next couple of slides
Awesome.
that are out there. We'll definitely address that about finding about terpenes at the dispensaries. But you're right, it does have a lot of effects. And again, that 1 and 1 is 3 is very, very important. Now, one of the questions that we get asked constantly is what strains are out there, and I call them cultivars now, because what we're finding out is that almost all of the dispensaries are looking at not only just the strain itself, but what does it produce. And I say that because if you take a look at strains that are really good for, or cultivars that are really good, and terpenes that are really good for anxiety and stress, you can see that there's a number of them here. ACDC is one of the most popular. Jack Herrera is very popular. You want to comment on a few of these, Zach?
Yeah, ACDC is by far one of my favorite strains. One, it's a 1-to-1 product, so you're getting, best of both worlds. You're getting a little bit of CBD, you're getting a little bit of THC, and some of the best terpenes that I prefer, with myrcene, pinene, and caryophyllene. And caryophyllene is actually considered as another cannabinoid itself, technically. So ACDC, something you can find at Trulieve. Our Granddaddy Perp, also found at Trulieve in a few different ways. You can get vape cartridge, flower. We also have our Harley Quinn GDP, which is a 1-to-1 product. And I misspoke. ACDC is going to be a CBD product only. So it is great still, though, to have those high levels of myrcene, which are technically what provide the indica diagnosis. Strains like Jack Herrera, more for the uplifting moods, more daytime. Blue Dream, one of my favorite strains, nice hybrid, acts similar to a sativa as well.
Yeah, there's again the high CBD products, especially with anxiety and stress, really help quite a bit. That's out there, and there's another list of those as well right here that you'll see. Again, you'll have the sour diesels, the OG Kush, the Girl Scout cookies, those types of things. All of these are very, very helpful. And again, the Remedy product, which is again high CBD concentration, really helps quite a bit. So I'm just giving you kind of a tip of where to go. And again, when you go and you talk to Trulieve, tell them your condition, but also they'll probably start talking to you about some of the cultivars that are there, which is not only the profile, the fingerprint is not only the strain itself, but also the terpene profile that's there. And we'll address that in the next couple of slides about terpene profiles and what's out there. So there's some recommendations on the cultivars to look at, but also we have routes of administration, because this also affects you quite a bit. Not only do you have options in this in the capability of the type of product that you take, but how you take it is also important. Zach, you want to tell us a little bit about the routes of administration?
Absolutely. Routes of administration are definitely going to have more effects, and I shouldn't say effects on your decisions and when you'll take these products to help with mitigating your pain. If it's breakthrough, if you're trying to use something more longer lasting, these are where you want to look. Products like our tinctures and sublingual products typically will take a little bit longer of an onset time, but the duration of those is absolutely much longer. It's also best for microdosing. So if you're a new patient, trying to use a tincture is great because you're going to be consuming very minimal amounts of THC as well as CBD per drop. And going back to the nano products we use, you can oftentimes see a lot of the onset times reduced in that. So maybe the onset time for a regular tincture is about 30 minutes. With ours, the nano products specifically, you might be able to get that within 15 minutes and still have actually a greater bioavailability, which just means that you're getting more milligrams per THC. Other products for, quicker, faster acting relief, inhalation, plenty of different options to choose from, whether that's going to be vaping whole flower, cartridges, true pods. Again, quicker onset. The duration time doesn't necessarily last as long. We have edible options that are very similar to our capsules in terms of duration time. Edibles, though, can be tricky. Always, of course, recommend starting low, go slow. Maybe use a half of a gummy or a half of a chocolate. See how it affects you, and then go after that from there for about 30 minutes. Edibles are a little tricky sometimes. What we like to joke about in the cannabis world is that they don't work until you start, kind of talking down on them, and the next thing you know, you eat one and you're wondering, what's going on. But not to worry. Some CBD by your bedside, your table side, whichever, will definitely help mitigate those. Topical
About
products.
the time you think it's not working is about the time it starts working.
Yeah, absolutely. And then you're in over your head almost. But the good thing about our body producing these endocannabinoids is that the receptors cannot overload from these, cannabinoids from the plant, which is why people can't overdose from the plant and die.
Yeah, and I want to comment on the edibles, capsules, inhalation, and sublinguals. Probably the most easiest way and the most popular way to start. A lot of people start with sublingual drops because they put them underneath your tongue, and that goes directly into your blood system. And that typically works. In my case, it works from 20 to 25 minutes. They say sometimes as much as 45 minutes, sometimes faster. But it really is something that's effective very, very quickly. It's easy to take, but it does take 20 to 30 minutes. In my case, I have 7 herniated discs in my neck, which is no picnic. And so I can wake up with high level of pain. And what I find is that I then, right on my bedstand, I have my sublingual drops, but I also have a vape pen. So I'll take my drops, and then what I'll do is I'll grab a vape pen and I'll take 1 or 2 hits from my vape pen. And literally within a minute or two, my pain will drop from a level of 7 or an 8 right down to a 1. And that the vape pen, so you can mix and match these dosing methods is what I'm trying to point out, because I don't want to live in that level of pain. I want to minimize the amount of time that's there. It helps me be able to do that, but also it helps me be able to get myself balanced really quickly in the morning. So it's something that's really, really there. We'll talk more about my favorite vape pens later on.
Absolutely. And I mean, going back to those tinctures, they're great because of the whole microdosing factor and being able to continuously provide your body, your ECS, with those cannabinoids will certainly help. Some people don't actually have a cytokine gland that breaks down some of these cannabinoids. So oftentimes you have to feed your body a little bit more in order for things to start working. And again, going back to the breakthrough pain, these are great. Those products that are vape cartridges or flower, whichever it may be, is going to help you with a quicker onset time. But then having those edibles there to really help with the longer duration and keep that pain at ease. And then also, I mean, you mentioned it earlier, when it comes to individualism, each person's different. Metabolism is different for each person. It's, 5 milligrams for you may be nothing to somebody else.
Sure.
So of course, always start low, go slow, do something that you're comfortable with. If you have questions, reach out to your physician, ask the consultants at the dispensary, and really find those answers.
I think the other thing is that the nice part about edibles it comes into play is capsules and edibles. They do take longer to work, but because they go through your stomach, they actually have a different process. They're processed differently in your body, but they last longer, which is really great.
Yep.
I know that one of the things that I have found these, myself and my mother, who's in medical cannabis, just before bed, we're chocoholics. So we actually grab a little chocolate. Well, we had to be very careful about the amount that we take, but I found that if I take about an hour or two before I go to bed, a little bit of chocolate, it helps me sleep through the whole night. Because the nice part about it is it lasts 8 to 10 hours in my particular case, where when I take some legal drop or even a vape pen, I'm looking at only a couple hours. I'd wake up at 2 or 3 in the morning, then have to redose that's there. Capsules are really good because it's something that people are really familiar with. I know my mother, when she got, we were treating her for breast cancer. She actually, was easier for her to take a capsule than anything else. She's so used to it. She was 88 years old at the time we started. This was just what she was used to. So we headed that particular direction, and here she is. She's 93 years old now, and she's still with us, and she's like an Energizer bunny running around.
That's awesome to hear. Now, I mean, and one more comment on that. I mean, my father, 70 years old, he and I play a lot of golf together. Oftentimes after he get done playing golf, he's having knee pain, he's having joint pain in his shoulder, wherever it may be. I started getting him on CBD, some cannabis products, and it was just miraculous, how things changed him from the pain, from, again, getting up at night, something he always tells me. He's like, when you get older, you're going to start realizing you get up more frequent to use the restroom. And, he's like, it's a blessing that he's been using these products. He's like, I don't wake up anymore. He goes and tells his friends to start getting on it. He's got his card. So he's now a huge advocate for Trulieve, especially, so I highly recommend considering these products, especially the capsules, for those longer lasting effects.
Capsules, and also you're heading into topicals, because topicals are great because you can put that right on the
centralized location,
neck, hand, or whatever, and they're much like the they typically act almost immediately, which is great, especially the transdermal topicals, which means it gets right through the blood, goes right into the bloodstream, and it acts right away. And like on your knee, your back, or whatever, that makes a big difference.
Absolutely does. Absolutely. And it's also one of those great things because it's discreet. Nobody has to know about it while you're using it. Some people think that it's just your regular lotion, cream, whichever. And it has a lot of great benefits in itself too. Also mixed with some eucalyptol, which opens up the blood vessels in those specific areas, which really allows for a deeper tissue massage.
Right. And then also, I know you don't have, but transdermal patches are very popular that are out there.
One day, hopefully.
Yeah, I know. I'm a transdermal patch fan myself, because it lasts a long time. I mean, it just makes it a lot easier. And then you also have meter dose inhalers. You also have sprays. You have other ways of taking it as well. You might comment on those.
Absolutely. Yeah, we have a great nasal spray. That's especially great for those patients who are epileptic, having episodes of seizures. It allows for their caregiver or someone else to directly administer that to the patient without the patient having to do so themselves. It's very quick onset time. Of course, we have concentrates, flour. Mostly everybody knows about flour being about 50% of all of our sales. Concentrates coming in with a close second. But concentrates, in my opinion, it's really about all of that I use. One, due to the fact that I've been a user for quite some time, so I do need a little bit more, but it's also, a little bit of that can go a long way, where I don't have to feel the need to use throughout the day, where I can then focus more about my average day. So highly recommend considering concentrates if you've been using cannabis for a while and can start, feeling comfortable while using those.
Sure. And then of course, what's popular is flour. I think everybody from history, our legacy is in the flour area for a long time. And of course, you've Trulieve's done a great job of providing a lot of different products in that area. That's kind of the mother of all products, from the flour, everything else comes from there.
Absolutely.
And then concentrates are basically taking flour and compressing it in a way that makes it, that puts it in with either, they have one called shatter, they have one called crumble. It's not necessarily for somebody who is beginning, but for those of you that have been in the cannabis for a while, it's very, very effective. And what I like about the concentrates is, what few people don't know is that when you take flour and you light it, you're burning off 50% of the cannabinoids and all of the terpenes. So you're taking a lot of the medical benefits away by basically rolling a joint and smoking flour. And it's not very widely known, but that's it. That's why I recommend, if you're going to do something, vape, because the vape pens they keep the terpenes, they keep some of the flavonoids that are there, plus all the cannabinoids. You're not burning them off, and that's what's important. That you're getting the medical benefits. So for patients that like smoking, I recommend vaping that's out there. And I know Ivy will answer your question in a little bit about that. But I find that, and one of the things that concentrates do is they've kept all the terpenes and a lot of flavonoids when you're using that. And again, it's much like vape. You control, the difference is you're controlling what's in the pen, as opposed to getting something that you buy that's already pre-mixed for you. Again, there's a lot of different ways of trying it. There's a lot of different options that people have. And I want to have you feel comfortable that there's something that's for you. Because you don't like one doesn't mean you don't like another. I mean, to be blunt, I'm not big into smoking flower, but I love vape pens. I think that's, and because of the medical benefits, let's put it that way.
I'm the same way. I mean, I love my flower, don't get me wrong, but it oftentimes can be an irritant to emphysema. And sometimes for me, it's just, I prefer the smoothness of a concentrate, a vape pen. Concentrates too, they're typically going to be isolated products, so you'll have higher percentages of THC. So if you're dealing with immense amount of pain, concentrates would be something that you would, ideally use because of the higher concentration of THC, which is why people use THC, is to mitigate pain. CBD, it can help, but it's not necessarily great for anti-inflammatory purposes.
Right. So let's get some questions answered right now. I mean, we've been at this for a little bit. Let's dig down on that. Let's knock off one that's really quick and easy. William asked the question: Are all these terpenes in the plant? Zach, you want to take that one?
Yes, all of these terpenes are in the plant. Now, not every terpene is in each specific plant, so you will have to vary or do some research, on the variances of each terpene and each strain. But for the most part, we've seen well over, I think, 200 plus different terpenes, and I think that number is even going to grow as time goes on and science starts to develop more and more popular chemovars.
Yeah, terpenes. We don't want to give you the impression that there's only 6. Those are the 6 that really address anxiety and stress. But there are over 200 terpenes that are out there. Treadmill Mills is probably one of the top terpene providers here in the United States, and they're constantly coming out and identifying new terpenes and trying to figure out which terpenes help with each different condition that's out there. So yeah, the terpenes are in the plant, and again, that's how the plant protects itself while it's growing. It's out there. It's part of its natural process.
Yeah, terpenes are found naturally everywhere. We actually did a webinar last time about terpenes, so if you're feeling like you want to go get some more education, I recommend that.
We have one coming up in about 4 weeks on terpenes. We'll be talking about that particular subject. Roseanne asked a question. She says, I don't know much about terpenes. I guess the bottom line of her question is, I see that dispensaries are limited in their products, and I don't think that these products have terpenes, or you can read about them. I know for a long time, a lot of the dispensaries really didn't publish what terpenes were in each of the products. That's completely changed, I think, in the last 6 to 8 months. Now it's almost the opposite. Trulieve and most of the major quality dispensaries really give you the terpene charts with each of the products that are out there. Is that right, Zach?
Absolutely. The difficult part is trying to get a label that won't cover up the entire box to have all of the terpenes, right? So it is difficult.
One that you could read because it's so small.
Exactly. So we are certainly working on ways around that. And let's face it, education is power. And if you are a more informed consumer, you are going to make better purchases and possibly more purchases too. But terpenes, unfortunately, right now, I wouldn't say they're on the label per se, but you can certainly go into any Trulieve dispensary, ask the consultant behind the counter, hey, can you let me know what the lab report is on that? And they'll be able to show you. And each of our products comes with a lab report too. There's a QR code, you can scan it, it'll populate, and you can then look, oh, well, this strain has all of these terpenes. Now, sometimes, that can be a little tedious. So one thing I also recommend is when you get home, look at that lab report, find the terpenes, use a website called Leafly, Leafly, and you can actually find strains that are very similar to the one you purchase based upon those terpenes. So there's a lot of resources out there to help you become a more informed buyer. It is difficult, I know, inside of the dispensaries to be able to provide all of the information that we'd like to provide. But I think it is something you'll see, here in the future, especially more focus on it because we know, how much terpenes are in play with each strain.
Yeah, and I think not only can you ask the bud tender behind the counter what you can actually say, I'm looking for these terpenes or what terpenes work for this particular condition, but also you offer as Trulieve a consulting service.
Yep.
It's free, and it can be done via a online, like we're doing the Zoom call, or you can do it in the dispensary. And you can talk about the recommendation, your particular condition, and what Trulieve products can help you by identifying the terpenes as well as the cannabinoids that help you.
Absolutely.
Yeah, and that's a free service that's out there. Another question that's here. I see a couple of people ask. I know Marcia asked a question. Why do some people have a bad reaction to very high CBD? And I know Ellen asked a question that said, I find that high doses of CBD have the opposite effect in my case. My doctor says it's individual, and the answer is yes, it is. CBD should relax you, but there are cases where it has exactly the opposite effect. In fact, I think one of your cohorts, Alex, has that problem. One of the community educators for Trulieve has that particular problem. It's not a common problem, but it's not uncommon either, okay, to have the opposite reaction with CBD and THC. And this goes back to the dosing. It's so individual how your body reacts to it. You really have to pay attention to do that. She says, it's individual medicine. Does CBD cause incredible anxiety? I know the THC is the opposite. The interesting is sometimes if people have a high reaction to CBD, they have the opposite reaction to THC. Again, that's so individualized that we don't know. And so this is where you really got to go low and go slow and find out what works for you. And that's the best recommendation that I make. You have some comments on that, Zach?
Yeah, it could very well again be an individualized experience where you specifically may just not have a great experience with CBD. It definitely varies. It's not common, I'll say that, but it could just be because it's high doses of CBD. If it's a high concentration, especially, it could very well just be overloading those receptors, and receptors just aren't working quick enough. So what ends up happening is causing a little bit of stress, anxiety, not really helping the problem or the cause go away.
So when you ask why that is, that has to do with the receptors that are in your body. That has to do with how your body accepts those receptors that are there. So they know why it happens. I can go through a long technical reason why. Just be aware that it's not uncommon. It's something that's there, and you can by going through a dosing regime of going low and going slow, you can actually find out the right mixture of THC and CBD. And in your case, you may want to up the THC a little bit to counteract the CBD.
And it could also be the strain that the CBD was derived from too. I mean,
that's true.
There's so many different things.
Yeah, and you might want to take a look at that as well. There's an excellent question. I know that I got an anonymous question from a gentleman who said, I retired out of the Army. And by the way, thank you very much for your service. We really appreciate that. It's something that is very well recognized, and thank you. We really, really appreciate that. He was mentioning that he's in Fernando Beach, and that's pretty close to you, right, Zach? You're in Jacksonville.
It is, absolutely.
Right. So he says a career infantryman with combat service in Afghanistan, PTS, TBI, all of the above, anxiety, sleep, apnea, to name a few. They're putting on heavy prescriptions of Xanax and others. I know that in dealing with a lot of patients from the VA, I think they have a starter set of about 12 different drugs that they start with. And,
Prozac, all of them.
I just find it's not good.
And to the attendee, as Marc said, thank you so much for your service. It is greatly appreciated. I would not be doing what I'm doing here today if it was not for you. So I don't take that lightly in what you've done. One thing I highly recommend to you is going into our Trulieve in Fernandina. We have a business card holder of all the different physicians in the area. There's quite a few. Help yourself to a few of those cards. Call up a few of those physicians, see which one might be best for you. I also really encourage you and invite you to come to our Jack's Beach dispensary. If you can, ask for the manager. His name's Ray Houston. He's a former veteran as well. He's got a great story behind himself. We do a lot with the VFW there in Jax Beach, and trying to really spread the word for veterans specifically on how cannabis can help them. He would be a great resource for you. I'm happy to connect you as well. I'll leave my information here in the chat for you, because I'd love to be able to connect you with that. Fernandina, again, we have a great dispensary there, a few physicians in that area as well. And if you're needing any help, we certainly love to be able to help you.
Yeah, and I work with the Medical Marijuana Treatment Clinics of Florida, MMTC. I do some consulting with them, and they have dispensaries, or excuse me, clinics in that area that can help as well. So there are doctors you can talk to, and I think you also have Trulieve as a dispensary that's there. But I think one of the things you were mentioning is using CBD and CBG tinctures daily. That sounds like it's a derivative of some hemp-based products.
Yep.
They'll help you for some of those conditions. But to be blunt, when you get into dealing with things like PTS, the TBIs and things like that, you need a higher level of THC to really address those particular conditions. So really, that's where you're going to need a medical marijuana card. There and there is a lot of efficacy, and there's a lot of we have a lot of studies that show how we can actually get people off of the medications. Now, you don't do it cold turkey. You don't stop one day and go to the next. You wean yourself off.
Don't recommend that.
But yeah, the answer to your question is yes. There is a way of being able to address that with people that know what they're doing, that can help you get there, and with the right drugs there. But you're going to need to take a look at some THC in your regime to be able to really address a lot of the conditions that are out there. And I know Kathy asked a question about what are the best terpenes for PTS. We actually are doing a PTS webinar at the end of March, but I can tell you most of the terpenes that you saw on that chart that we had, especially the linolols, the myrcenes, those types of things will help you quite a bit. The one you want to really try to stay away from is pinene, because pinene does bring back memory, short-term and long-term memory effects. And what you're trying to do with PTS, whether that's being a veteran or just from a particular condition where you had something in your life that created that condition, you want to stay away from a lot of the products that contain pinene in it. That comments on that?
You absolutely hit that home run right there. Myrcene, linalool, certainly two of the most popular terpenes to help with stress relief, PTSD, anxiety disorders. We again see indica heavy plants containing a lot of myrcene. Indica heavy plants are typically the ones considered to be used for those patients dealing with PTSD, anxiety, things along those lines.
Yeah, Fox, I'll answer your question, but what I want to do is I want to answer Roseanne's question. She said some lingual drops are oil-based and some are alcohol-based. Is one better than the other? And better again goes back to what your body works with. But I think that alcohol-based terpenes tend to be working a little bit better. But sometimes, especially if people have alcohol problems, or again, based on your body, you may not want to take a look at an alcohol-based terpene. Alcohol-based product. You may want to take a look at more of a MCT-based or an oil-based product.
Absolutely. It definitely varies upon preference, upon many different things. Alcohol is a little bit more of a polar substance, but the oil is going to actually bind those cannabinoids a little bit better while you're consuming that product itself. So, alcohol, I would say better for a sublingual product. Oil-based, definitely better more for an oral product.
Mm-hmm. Great. That's out there. I hope that answers that question. Fox had a great question. She said, Marc mentioned vape pens as a route of administration. It's important for quick relief. But the vape pens have a dodgy history. And the answer is thanks to some over-the-counter CBD-based products that came into California from Asia, we ended up having some people die and getting very sick and giving vape pens really a bad rap. Two things, I'll make a comment on that. First of all, none of those products were ever tested. There are not tests being done on the quality of the product that was out there, which is something that's been addressed now that really you need to pay attention to. When you're going to buy a vape pen, check the certificate of authentication, find out if it has been tested. And what are you looking for? It's been tested at least 3 times, twice by the manufacturer and 1 from a third party. And number 2, that the COA is at least within 2 months old. Okay. If you have a COA that's dated or something that's done 6 months ago, buyer beware that they may be just pumping out fake COAs that are out there. But all the dispensaries here in Florida have to certify for health. They worry about metals and all the things that cause the problems that are there. So if you buy a vape pen from a quality dispensary like Trulieve, you really don't have to worry about it. In fact, I recommend vape pens as the way to go, especially when you're first starting, because if you don't mind the vape, it is something that works right away. You can see the effects right away, and it really helps you quite a bit. Now, vape is not smoking. There's no nicotine. There's no carcinogens in it, but it does go into your lungs. So you have to be a little bit careful of that. Some people don't like to do that, and so that's why I understand the sublingual drops and the capsules and things and topicals come into play in that particular area. But vape pens are safe here in Florida if you buy them from a Florida licensed dispensary. That comment?
Yeah, I mean, you definitely again hit everything on the head there. If I was to give you some of my recommendations at Trulieve, as far as our True Pods go, they're by far my favorite type of style to vape. One, because it seems like they last a little bit longer, being truthful. But two, they seem to have better taste. They're cannabis-derived terpenes for the most part, so they're going to be more of a naturalistic taste. It's like getting fresh fruit from a farmer's market. Or using what's called our True Pod vape stick or True Stick, and there's variable settings on it. So of course, if you want to be able to preserve a lot of those terpenes, you can have a low setting. If you're really seeking more of the THC benefits, place it on that high setting. So that's one option for you. If you're more into like the tube style vape cartridges, which are known as our 510 thread, there's a few options in those. One, I recommend going with our live sauce cartridges or Blue River live rosin cartridges. One, because they're going to be your holistic approach. You're getting the full spectrum. You're getting all cannabinoids. You're getting. There's actually a Trulieve dispensary near Southern California. It's called Reef Dispensaries. And unfortunately, we can't ship to you due to federal legalities, but there is a Trulieve in California. And you can actually find it on our website, trulieve.com. You can click on the California tab and it'll locate the two different dispensaries that we're a part of. So I would certainly do that. And actually in California, you all have a lot more choices to choose from, being that is more of a wholesale type of state. So I would even go in, discuss with your consultants there, your bud tenders, and talk to them about their preferences.
Right. And I think, and one of our moderators, Lee, and I'm going to give Lee, thank you very much for reminding us. It brought up that a lot of the pens that were brought in, really, when they were brought in by off brands that were using a liquid that was really vitamin E, which was not vitamin E carrier oil, which was really not good to inhale. They were not tested. They used a bad product. It's something that, in fact, was fascinating. Is it took them a while to figure out who actually manufactured those pens, and they did come from Asia. So stick to quality manufacturers. More importantly, stick to going to a dispensary that has a COA, that is a quality dispensary, and you'll be able to find products and pens that will be able to get there. Don't buy them at the gas station. Be very careful of your local head shops. I know that I'm going to probably piss off a lot of people who own head shops, but some are great and most of them aren't. And that's the problem that I have with them. I just find they haven't tested the products as much as they should. And I'm a medical guy. I'm not a recreational guy. So I tend to want to know what I'm doing, and I want to know that it works, because I need to have it be replicable consistently that's out there.
Yep. A lot of those hemp products are growing more for the manufacturing side versus the medicinal side.
Right, the recreational side. Kiara did ask a question, and it was in the chat, and I want to bring that up. It says, are topicals containing THC psychoactive? You want to address that? You want me to address it?
I'll happily address it. No, they are not psychoactive. They're not going to break the blood-brain barrier. Therefore, they're not going to provide the psychoactive effects that THC often provides.
Right. So but they are very effective for pain, which is really nice. Especially even if they have THC in it, they're very, very effective for pain. I really find that topicals help me quite a bit. Let's put it that way. I'm a senior citizen, so guess what? I got pain. It's out there. I put this slide up because I tend to, when I got into business, I think there were a lot of people worried about the quality of the manufacturer. Your shops are clean. They look good. Kind of like a Chico's kind of thing.
Absolutely. That's one of the biggest surprises for all my physicians when I bring them in to Trulieve is, they're of course in a mindset of that there's going to be, druggies around, there's going to be, all these bad things. And it really is great to break that stigma when you bring them inside and you just see people that are trying to help themselves and better themselves. And of course, it's not the dispensary style you think about when you go out west in Colorado, California, where there's buds everywhere, jars of cannabis and concentrates and edibles. But we do a great job of laying out all the different product varieties that you'll see. And then we also do a great job in providing well over 300 different SKUs of products to offer to all patients. So anything that you find, there's certainly something that Trulieve has to offer. The great thing about it is that all of these products here are backed by our return policy. So if any product that you purchase, you don't like it, you can certainly take that back and get something else.
Sure.
As we spoke earlier regarding this CBD causing anxiety, well, if that's the case and you purchase that CBD product from Trulieve, feel free to take it back, get something else, really help yourself along this journey. We know that it's not cheap to go through all of this. Insurance isn't covering it, and we want to ensure that you're getting the proper medication.
Yeah, I think that it's important that your return policy is really key, because if you try a product and it doesn't work, even if you use half of it, you can bring it back. And I think that's important. You're not running up a bunch of bills buying bottles that sit on a shelf that cost you a lot of money and it don't work. You guys have done a great job. And also, I'm going to again go back, use the consultation services that are there. They're free. And they're not doctors. They're not there to make a medical recommendation. They will take a look at your particular condition and they'll tell you about the products at Trulieve that have been designed to be able to help that. And we'll talk about that when we get to the cultivars in just a little bit.
Absolutely.
But you can see you have a bevy of products that address each of the different dosing forms.
Absolutely. One of our biggest things with Trulieve is making sure that patient access,
Right.
Patient access comes in multiple dispensaries. It comes in multiple products, and being able to have all of these products readily available for patients and making sure that, you do have different options. You do have, your flower options, your vapes, your edibles, there's more than one way to skin a cat, right? So there's got to be more than one ways to be able to treat ourselves as well.
You also have some great nano products that are out there to help.
Absolutely. These are some of my favorite products to talk about. One, because of the efficacy on them. You can dose with so much less than what you need with your regular tinctures because of the fact that these are nano products. So essentially all we've done is taken that THC CBD molecule, and through sonification, you can actually break those down into smaller particles, then using different types of carriers. So maybe an ethanol carrier, MCT, which will then bind those receptors and keep them separated. So all of that sounds very confusing and sciencey, but how I paint the picture is if you think about a chain link fence and we pretend that THC or CBD are tennis balls, and we try to throw 10 of those tennis balls through that chain link fence, which the fence is representing your blood-brain barrier, your cells, you may get 2 to 3 tennis balls, so representing about 20% bioavailability. But with the nanotechnology, the sonification, we're actually making these more into golf ball size particles. So taking, again, 10 of those, breaking in and providing 20 of them, and now going to see about 80% bioavailability when we throw those through our imaginary fence. So again, dosing with a lot less, higher bioavailability, greater efficacy on the products. They're also going to be cheaper than your other products too. You'll see we have a True Nano 250 milligram tincture, which is now $40. We also have our True Nano gels. These are $5 more than our regular gels, but again, you're getting more per milligram per dose. So
you can actually take less product.
Correct. You can.
In the end, what you're doing, you're taking less product to get the same effect. So you're actually saving money in that area. And so you got to be careful, because if you take the same amount of a non-transdermal versus a transdermal product, then you'll find that their sonified product, I should say, you'll find it makes a big difference.
Absolutely.
Yeah. And then I also want to point out, you also come in different ratios. You have tinctures as well as gels.
Absolutely. We have our 8-to-1 as well as a 1-to-8. You can even find our 1-to-1 products that are going to be available as a nano style too.
8-to-1, 1-to-8 means 8 CBD to 1 THC, or 1 CBD. Again, it's the CBD to THC ratio.
Yep. And anytime you hear those ratio numbers, that first number will always be CBD followed by THC. Right. And of course, there's different cases with, if you're talking about CBN to THC, those numbers may vary. But as far as ratio products, it'll always be CBD first, THC second.
Right. And you have, again, you have your ratioed products that are out here, a whole bunch of things that are there, and you're getting into your favorite vape pens that are out there as well.
Absolutely. I know you're a big fan of the Delta 8 and the 1-to-1-to-1. Certainly one of the more popular items that you'll see out there. It's great for its benefits from Delta 8, but also Delta 9, and you're getting some CBD in there to mitigate some of those effects.
Yeah, the 1-to-1-to-1s mean you have one ratio of Delta 8, one Delta 9, and one CBD. Now, what does that do? In my particular case, with not only just a herniated disc in my back, but I also had a left knee replacement done a couple of years ago to complement my right knee replacement done 18 years ago. Between knee pain and my neck pain, it's part of the regime. What's fascinating is, again, here's my vape pen of choice. I was telling Zach, you'll if you frisk me at any time, you'll find a laughing Buddha vape pen on me, because it really helps me during the day, especially as I run, if I'm walking, I'm out doing certain things. I decided to challenge my senior citizen body. I'm into the wax on and wax off version of Tai Chi, which means I'm getting a heavy workout, and I use those products to really help mitigate the pain that's out there. And I love it because you have the difference between Laughing Buddha and Diablo is really the terpenes. Again, we're going back to that, but also you have one that's the CBD and Delta 8, which is you call it pink lemonade. I have one of those too. Those worked out really well. That works out very, very well.
Absolutely. Delta 8 is becoming a more popular cannabinoid. We'll start to see that one out as well. It has great medicinal benefits. It's not providing so much of the euphoria that Delta 9 often does.
Right. And I will make a note, Delta 8, make sure you're buying from a quality manufacturer. There's a lot of bad Delta 8 products that are out there. Delta 8 is getting, you see every CBD shop saying, I got a Delta 8 product. Be very, very careful. Be very careful. I would say make sure that you have a quality manufacturer. That's one of the, we had an interview with Holly Bell, and that's one of the things she's doing, working very hard to try to make sure we have quality products that are out there. And she's taking a lot of products off the shelf as she's moving forward. Yep. So but the problem is that they're so popular. It's she's like the roadrunner chasing things out there to try to get these things to happen. Now you have some great discounts as well.
Absolutely. One thing, again, going back to our return policy, again, it's more of an encouragement to really say, hey, come into our dispensary, try some products out, find out what works best for you. And then after that, you can really be able to, maneuver your way through the system. But for first-time patients, we offer 50% off. Go in, get what type of products you prefer, and then really, take full advantage of the discount. Again, it's not cheap. Insurance isn't covering this. We have other ways to help too with our loyalty program, which is our Trulieve points. We have offer veteran discounts, birthday discounts, SNAP or EBT discounts as well. There's certainly multiple ways to take advantage of the fact that, one, you're paying a good amount to your physician, and then you're paying some at the dispensary too. Find those ways to help yourself, spend a little bit less money. These are great ways. Sign up for our text alerts, emails. Every day it seems that there's some new discount going on. Mondays, especially going to be mini Mondays, everyone's favorite day. Wednesdays, ground flower. We're also doing our refer a friend program currently. So bring someone in who's never been to Trulieve before. You and that person will get 50% off. Currently, which is awesome, we're seeing patients are starting to be approved same day now. So, hey, you have a friend who is in need of a marijuana card. Take them to your physician, get them signed up immediately, go right to Trulieve and both save yourself some money. So you'll start to see some discounts rolling out around that. And we're hoping to be able to provide and save as much money for our patients as possible.
Right. I should also point out, you talk a lot about flower mini, minis are the mini buds, the little ones. There's basically three places on the plant. The top ones, the mid and the bottoms have mini buds, which by the way are great to drop in your coffee in the morning, because if you drop it in your coffee, it brings out the THCA and CBDA, which is the pain relief and the inflammation, without CBD and THC. So you don't get high, but you get all the pain relief. But I think that a lot of times, and what I found interesting, I'm taking a class right now, and we're talking about flour. Here in Florida, almost 30% of the flour that's bought is used for cooking. People do their own things with it. In other words, not everybody's out lighting up one. They're making it into tincture oils. They're making it into gummies. In my case, I make my own tincture oil that does have. I buy from Trulieve. I get the mini buds, which I think is great, and I'm able to make my tincture oil that really addresses my pain and my inflammation. Which
Absolutely.
Really,
Many people prefer that. I mean, again, going back to the whole entourage effect, using whole flour, you're going to be able to provide more of those medicinal benefits of the whole entourage effect itself versus your typical edibles, which are going to be made with your distillate. So it's typically just THC. We do offer 1-to-1 varieties as well, but
right.
If you're wanting more of the one natural taste, some people like the taste of cannabis. Whole flour is a great option, or using RSO as well.
Right, that's there. So, but
you can always find on our blog recipes, ideas on how to cook. So help yourself. We can't necessarily tell you in the dispensary ourselves due to a few different regulations, unfortunately, but we could certainly help you on our website.
Sure. And again, your orders and delivery, I think if you're over the age of 65, you get free delivery.
That is correct. So helping out our geriatric patients and our elder patients to be able to ensure that they, aren't having to come out of Social Security, Medicare, whatever it may be. And hey, spend $200 or more too. If you're not 65 or older, you can also get free delivery. Otherwise, it is $15. $200 is not necessarily hard to come by at the dispensaries, if I'm being honest. But again, finding ways to help yourself save money, it's a great way to, and save yourself some time.
Yeah. So we had a couple other questions that came up. Fox asked the question, are there any Trulieve dispensaries north of Los Angeles? Zach, I'm gonna let you answer that one and give her the geography on that. You'll have to look it up, right?
I am not entirely sure about the California region, so I'm just going to name off all the ones that we have in California for you, and hopefully you'll know. We have 2 in Palm Springs. We have 1 coming in Pasadena, which I believe Pasadena is Southern California.
Yeah, it's northern part of LA, right?
Yeah. We also have 1 in Grover Beach. We have 1 in Napa. So sip some wine, use some cannabis, get to really dig your hands in the soil. There's also 1 in Venice as well. So those are our 6 in California currently. It's possible we expand at a future date and time. I apologize if none of those are in Northern California where you're seeking. I know Napa's a little bit further north.
Wait a minute. Northern California, you can call Napa, fall in that.
Yep.
I'm a California boy, so I can fall into that area.
So
good. And I hope that helps. The other question is, anonymous question, is vaping bad for your lungs? And I'll address that if you want to address that one, Zach?
Yeah, I can certainly. Again, waiting on studies for that, certainly, to really be able to dictate and tell, like, hey, is vaping different from smoking? Is it different from, smoking cigarettes, especially? I will just say that inhaling anything over multiple periods of time is not necessarily great for the lungs. So with that said, be cautious. Your body's going to tell you a little bit more and sooner, especially, to tell you that, hey, you really maybe should slow down. You might start having breathing problems. And when that's the case, absolutely, think about other options.
Right. Yeah. One of the other, anything you put in your lungs, you always have to be worried about, but there's no carcinogens. And vaping has a minimal effect on your body itself. In fact, fascinatingly enough, a lot of people say, well, I'm worried about putting something in my lungs, but yet when you have a lot of lung conditions, they use bronchial inhalers, which I find very interesting. And if you take a look at some of the terpenes that are in cannabis, they actually work just like bronchial inhalers to open up your airways.
Absolutely.
So that's out there. So I hope that helps. Anonymous asked the question, says, what if you are 65, over or not over, but exactly? I'm a senior citizen, and I have to tell you, anybody over the age of 55 really needs to take a look at using medical cannabis. And we're going to jump into a section of how medical cannabis works. So this is going to be more of the technical side of it in the next few slides. But the answer is absolutely. As you get older, your body doesn't produce the endocannabinoids as it did before. And so the more you can help supplement your body, provide the material that it needs to be able to put yourself in homeostasis, the better it's going to be. I just can't imagine somebody over the age of 55 that doesn't, and you mentioned 65, that's well over 55. I think anybody over the age of 55 should consider cannabis one way, shape, and form. Right? Yeah. So we're going to change subjects for a second and talk about cannabis and how it works. So we're going to get a little bit more technical. And we talked about cannabinoids, which really are the compounds found in cannabis. And why are they there? Because they help your body get in balance. It's called homeostasis. Your endocannabinoid system, which is found throughout your whole body, really helps your body communicate through your nervous system. It helps you identify where your problems are. And then your endocannabinoid system provides the relief that's there, that you find that's up there. And again, we saw this slide before. These are all the different conditions that are being addressed by endocannabinoids. I'm not going to drive down into that, but we do know that they're very effective and that they do work. And again, I covered this slide before. We're going to talk more about how endocannabinoids and photocannabinoids really affect your body and what they're doing that's out there. Let me back up a little bit. We talked about how the THC and the CBD, we work with CB1 and CB2 receptors, and really see CBD receptors, CBD addresses a number of other receptors. So here are the receptors that it actually addresses. And what's interesting is there's some studies and articles that are out about this this thing called GPR55. What they're finding out is that CBD really works with that receptor, and they're looking at actually calling GPR55 CB3, just to give you an idea. Don't be surprised in the future if you hear that term, and that's what they're talking about. It really helps you regulate a lot of your bone and your blood flow, and that's what's really important about that one. It helps you modify pain, and this is the one that really addresses pain that's in your body. And I'm not going to go through each of these. We're going to provide these for you, but we do know that when you use cannabis, it is addressing these receptors, and those receptors have a lot of different effects on your body. And this is, again, how your body regulates itself. It's out there. This is part of the studies that are coming out, right, Zach?
That is correct.
Yeah, we're learning
more each day.
An awful lot about that. So we talk about THC, and THC many times gets vilified as being because of the psychotropic effects. Now, some people like to get high. That's what the recreational market's all about. Some people don't because they don't want to lose control. That's totally understandable. But what you need THC for is to block the pain signals. And I know we had a question earlier about about PTS and about pain. Well, without THC, at a certain level of THC, you're not going to address those particular conditions. And it's more than what you'll find in a hemp product. Let's put it that way. It's more than 0.3% THC. So that's what's really important, is to be able to know that THC is valuable. But again, it's something that you have to take a look at, and you have to manage itself that's out there. There's a number of different conditions, and the medical benefits are widely known. CBD, as we mentioned earlier, it acts as what they call an inverse agonist. And what's an inverse agonist means? It goes against what happens. The prime example, CBD blocks some of the psychoactive effects of THC. You want to comment on that, Zach?
Yes, I'm sorry. I was just mind blown by the chat. Apparently, someone in here used to work with my mom.
Oh, really?
Small world, yes.
There you go.
Yes,
cool.
That is too funny. But yes, CBD definitely can interact with the effects and help mitigate some of the psychoactiveness that THC can provide. That's why oftentimes many physicians will highly recommend using a one-to-one product, using something that's going to have some higher levels of CBD, especially for your new user who may experience more of the anxiety and stress around using cannabis itself.
Sure. And the question came up earlier about from the veterans, that the anonymous veteran, about being able to get off of these medications. CBD has a long track record, an effective track record of treating opioid addiction and really getting you off of opioids. Your opioid receptor in your body works very well with the CBD receptor, with CBD, and it will help you be able to help get yourself off of it. Now, again, don't do it cold turkey. Okay, this is something that over time, but also helping with that helps quite a bit. And also they have a lot of studies have coming out lately about how it helps with diabetes as well.
Absolutely. And I saw earlier you were showing one regarding obesity, and it absolutely can maintain homeostasis and regarding your metabolism.
Right. That was a THC slide. Yeah, absolutely. So there's a lot of medical benefits that are there. We're learning more and more about it. And this is again where you have your the three musketeers, your medical marijuana doctor, you have your medical doctor, and you have your dispensary. They all work together to be able to provide really some solutions for you that's really out there. Now, how does the endocannabinoid system work? Well, this is how your body maintains homeostasis. This is how your body is be able to regulate itself and put itself into a position where it really helps itself. As we mentioned earlier, the CBD and THC work like a lock and key with your human receptors. And this is what modulates, and this is how your body controls pain, sleep, memory, appetite, inflammation, and your immune system. And the CB1 and CB2 receptors you can see throughout the body have a lot of different touch on and affect a lot of different things.
Absolutely. You hit that right there. Lock and key drivers.
Yeah. Now, what's interesting is we talked about the CB1 and CB2 receptors. CB1 receptors primarily in the brain and the central nervous system down here. CB2 receptors scattered throughout the body. CB1 receptors are or THC works very well with CB1 receptors. And you might say, how do we, when you get this we talk about lock and key, what helps that lock and key? What's the oil that puts the lock and key to work? We have what I call the dynamic dual. We have AEA and 2AG, which we have in our body. This is what we have in our body that takes the THC and helps it bind right there, helps the binding process and helps puts products together. And I think that we don't talk much about it, but what I do want to point out is they're very effective. You should know they're there because I call them the dynamic duo because just like they run to problems, as opposed, our first responders run to problems. That's what they do. And so what they'll do is they'll actually come into your body, and this is where they'll work with CB1, for example, with THC, and this is where they block the pain that's out there, and they help make all that happen. This is the mechanism that cannabis uses to be able to work with your body. It's important to know that, just know that they're there and know that they work with you. Same thing with over here, they work with CB2 as well. So a little complicated slide, but I thought it was important. Those terms are coming up. And one of the reasons I bring the terms up is because they're actually thinking about making AEA. They're talking about potentially having it look at it as a cannabinoid itself, which I find very interesting because the AEA, anandamide, what that is your body's version of THC. Best way of putting it. Okay. And so you're actually producing that, and it plays a major role in your mood and how you feel. The 2AG product really works a lot with both receptors that are out there, but it helps with control your appetite, your pain, your mood, and more importantly, it works very closely with your fatty acids. Now you might say, why does that have to do with it? It's because cannabis, when it comes into your body, is stored in your fatty acids. It doesn't go directly to CB1 and CB2 receptors. When your body sees there's a problem, what it does is your neurons say there's a problem. It triggers your body to produce the endocannabinoids by pulling from the fatty acids and sending those endocannabinoids to that part of your body. We have a diagram on that in a few slides, but that's really how the whole process goes together. And I'm trying to connecting the dots for a lot of people right now. We talked about the entourage effect, and this is how the entourage effect works because your body knows you have a problem. You don't need a doctor to tell you that you have a problem. Your body will tell you that you have a problem. And then what it does is it then produces the medicine it needs to put its body back into homeostasis. You've seen a lot with the entourage effect, haven't you, Zach?
Yeah, absolutely. As we hit on this earlier, entourage effect is by far one of the biggest things talked about in terms of using cannabis with your body and trying to figure out, the best ways to help your body and using the entourage effect. Again, you're getting all the cannabinoids, terpenes, so you're getting more medicine, if you will, rather than just using isolates or just those THC or CBD products themselves.
Right. Now, when I got in the industry and through my years of growing up in California, all I heard about was indica and sativa, and those are actually plants. They're bushes. You want to tell us a little about indica and sativa, and also what's going? We'll talk on the next slide about what's really going on currently with those particular terms. Let's put it that way.
Yeah, so the nomenclature that is currently is, sativa is going to be more of the uplifting plant. It's typically tall in nature. It's actually cannabis sativa is what hemp is considered. It's the genus of the plant. So, it's what a lot of people have seen when you see all the cannabis that's 10 feet, 12 feet high. It's typically going to be your sativa plants. It's narrow leaves, longer flowering cycles. It's also better suited for warm climates, which is why you'll oftentimes see these type of plants growing like a weed and really, showing a lot of abundance, a lot of height, a lot of growth. Sativa's got a lot of different effects. Again, more of the uplifting. Sometimes sativa can, going back to the anxiety and stress, more so inhibit and you know, make the effects a little bit worse. So sometimes you may just again want to check on the terpenes involved with that. Indica, short in stature, broad leaves. How we remember that is indica, indicouch. A lot of these products are going to be heavy in myrcene, which myrcene is again known to help with anxiolytics or anti-anxiety. It's great for anti-inflammatory properties. Sometimes causing those two together will cause for the whole lethargicness, passing out, tired. And then you have, of course, now hybrids. So they've taken these two different chemovars and then basically through genetics mutated them, and now they've got specific hybrids
Right.
themselves.
And that's where we're coming into places. You got the indica sativas, and now by mixing them together, not only getting the hybrids, but we also know that the cannabinoids that are inside the plant, and they're actually breeding plants. From a genome standpoint, they're actually putting plants together that they know they want to higher, for example, higher in CBD, to have more CBN, those types of things in it. So really, the terms indica and sativa are being replaced by the terms more like cannabinoids today. It's safe to say. Although
Mm-hmm.
hybrid is a general term that's out there. And then we also have the terpenes that come into play. So when you put the cannabinoids and the terpenes together, you have something called the cultivar. And what is the cultivar? It is the chemical fingerprint, basically, of that particular plant that's out there. And I know I had somebody told me a Jack Herrera is not a Jack Herrera is not a Jack Herrera. And a lot of it has to do with the plant that's being grown and the amount and the terpenes that are being grown or being being engineered for that particular product. And that's what generates your cultivar collection.
Absolutely. And what we've done again, truthfully now everything isn't really a high or isn't really an indica sativa. Through all the genetics we've done, they are becoming more of a hybrid plant, truthfully. But you can still
Especially
grow.
in the medical marijuana field. Yeah.
Absolutely. And what happens is again, we're trying to get the best strains available, the best genetics possible. So we are, mutating strains, we're, pollinating them, cross-pollinating, making sure, we can try to get some of the best medicine possible. So that's why you're seeing higher THC percentages now. You're seeing strains with, a variety of cannabinoids more specifically grown for a specific condition, which again is what our cultivar collection will be surrounded about, is making sure we're providing high quality flower, high quality products with high level terpenes, you know good THC CBD percentages in them as well, and these are going to be those strains that many people seek for years to come.
And probably 5 to 10 years from now, you'll be able to walk in and we'll actually have cultivars that'll actually say good for and different
Absolutely. I mean, and
that's where we're headed.
Going back to Leafly, a lot of the stuff they use on their websites will actually show them.
Right. Right. Now, the other thing that comes into play here is how do you find your sweet spot? This goes back to your dosing. And I tend to look at dosing like alcohol. I wish I'd have learned about, we talk about go low and go slow, meaning start with like a 1-to-1 product, take 25 milliliters, try that for a day or two, find out how your body does, and then increase the amount of, the from 25 to 50 to maybe 75 milliliters every 3 or 4 days to see what's there. And then when you get started that psychotropic feeling, then back down and you can increase the amount of CBD to find out what's there. And by the way, if your CBD have CBD issues, you might want to increase the amount of THC that's there. But I wish I'd have learned when I was learning about alcohol. It has different effects. I mean, I have friends who have one drink and they're done. I have other friends that drink the whole bottle. I was in Scotland for a while and I learned very quickly, don't drink with the Scotch and don't drink with the Brits and the Germans. They can drink under the table. But I'm just saying everybody has their own personal biology. And that's the same thing with cannabis. Some people like drinks that are, that are light in color, gin, vodka. Some people like the dark stuff, bourbon, scotch. Some people want an umbrella in it, it's out there. You really got to find out what works for you and take the time to do that. And when you do that, however, listen to your body. Your body will tell you what's working. Your body will tell you what's not working. That's why you want to keep some CBD around to be able to loosen down, to damper the THC effect. But when you listen to your body will tell you exactly what's working. When you find that sweet spot, that's why they call it a sweet spot. It really works.
Absolutely.
And you help a lot with your consultation services on recommending different products, right?
Absolutely. That's one of the main reasons that those consults are there, is to help you find the products that'll work best for the conditions that you're dealing with.
Right. And to kind of summarize, we talked about the endocannabinoids and the phytocannabinoids. They go into your body, and what happens is your brain will then will take those endocannabinoids in, put them all together, and then that's how your endocannabinoid system regulates your appetite, sleep, mood, immune system, memory, that type of thing. Now there are synthetic cannabinoids that are out there. These are primarily purely THC, although the FDA did approve a synthetic product. They call it a cannabis product, which is, it's not really, it's derived from isolates, but it's really not, it's not a whole plant. It doesn't have the terpenes, doesn't have flavonoids. I'm really, Sativex and Epidiolex, I don't recommend at all. And I know that goes against a lot of scientists, but it was one of those things where you pay the FDA and you get yourself a license. And I'm saying that tongue in cheek. But I think you want to stay away from the synthetics. Stick with whole plant. There's a reason why we do whole plant, because you get the full benefits of the product of cannabis that's out there. And the reason for that is because your brain will see you have a problem. It'll then work with the cannabis that you put in your body. Let me go here. And when your cannabis goes into your fatty acids, as I mentioned before, it's stored there. And when you see your neurons say, your nervous system says there's a problem, what it does is it converts those fatty acids into long chain fatty acids. And it then gets sent through your blood system to that part of your body to address the knee pain that I might have, my shoulder pain, like I say, from Nana, or the arthritis, or things that are out there. So this is a very important process. This shows two things. This indicates two things. First of all, this is your body producing its own medicine. That's why one of the reasons why a lot of people don't die from using cannabis. We've never had a death from using either recreational or medical cannabis that's out there. I think that's important, as opposed to the opioids and a lot of the pharma drugs that are there. So this is one of the main reasons. Also, the fact we don't have any CB1 and CB2 receptors in our brain stems. So you're not going to stop breathing. You're not going to stop, your body's not going to, heart's going to stop beating by being able to use cannabinoids. But more importantly, your body knows it's there. But also, your body knows where you have a problem. It knows you might have a pain here. It knows where you might have some stomach problems and things like that, IBS problem. And by being able to provide the raw material to your body, you'll be able to address those issues. You don't need a doctor to tell you you have a problem. Your body knows. It does it itself. You've seen a lot of that, right, Zach?
Absolutely. And the cannabinoid system will certainly help, again, regulate the, as far as regulating the entire body, providing it more of a synthesis. I can't think of the word right now. I apologize. But what it does, essentially, you talked about GI issues. There's been a study that shows some patients with Crohn's, some patients that are just dealing with many different GI issues may not have those level of cannabinoids or endocannabinoids specifically, such as anandamide. By delivering more cannabinoids such as THC and CBD, we can absolutely help mitigate some of those effects. Right.
There. Now this is the routes of administration slide. I know I don't want to go through this again. I do want to say that Manny, who is actually coming to us from Facebook, had a question. He's with Cannabis Wellness Advisor. That he's a Cannabis Wellness Advisor, and he was mentioning that there's some confusion in the consumers are looking at THC or CBD. Really, people look at those two, but terpenes play a large role in really how it affects your body, and also the routes of administration that they're being used. And Manny, you were right on. The terpenes with the cannabinoids are really let's just say the formula to get the job done. And you're right, this is something we need to look at. You need to look at both of them. And that's why people like Trulieve are making the terpenes more visible, what's out there and what to use.
Absolutely.
And it's there. So we've already covered the routes of administration. So let's just go back one here. And wait a minute, hold on. move there. Again, we're going to go back to the dosing slide. And if anybody has any questions on this, please let us know. Again, I view this very similar to the way you started with alcohol. You know, I wish I'd have known that when I was in college. It made my life a hell of a lot easier. It saved my body a lot of time and torment. Let's put it that way. But you'll know very quickly what works and what doesn't work. I know that in my case, because I had such a high level of pain, I knew right away what worked. And one of the things that when I had my knee operation, knee replacements aren't fun. One night I actually ran out of the high THC product, and I was kind of panicked because I was in pain. So I took a little bit more of the CBD product, and guess what? My pain went away. And when I went and talked to my medical cannabis doctor and said what was going on, he said it's very simple. Your pain was coming from inflammation, not from the bones and not from the operation. And by increasing the amount of CBD, what you're able to do is reduce the inflammation. When you reduce the inflammation, it reduces the pain. And it was kind of like a light bulb went off that, you know, I was treating the symptom and not the problem. It's out there. And that's why dosing is very, very important. And also pay attention to the terpenes that are out there. Talk to your doctor. And more importantly, talk to your dispensary and listen. And lastly, and most important thing, listen to your body and find out what you're comfortable with.
Absolutely.
Cool. Well, what's the bottom line, Zach? The bottom line is you are in control. That's what people don't realize by using cannabis. You know, you're a lot of times when you get into the pharma world, you're not in control. They're handing you things that, you know, they tell you will work. Take 2 pills, I'll call you in the morning. But with cannabis, you are in control. The amount that you take, how you take it, what you take is really important. And you can be able to adjust for what's out there. You're not going to get addicted. You're not going to overdose. And what's going to happen is you will get the entourage effect. Those are the things that you will see that's out there. So I'm going to address the issue of addiction for a second. A lot of people ask me, am I addicted to cannabis? Because I've used it now for almost 6 years for my neck operation from an auto accident. I'm not addicted to cannabis. What I am addicted to is getting rid of the pain. Every 6 to 8 weeks, I will take a day or 2 off to let my body reset, let my endocannabinoid system reset. Candidly, it gets a little bit lazy. When it gets some help from the outside, it may get lazy and not do the job it should be. By taking a day or 2 off, it refreshes my body, helps me get back on track. I need less cannabis to be able to get the same effect. I don't need the cannabis from the standpoint I'm not addicted to it. But what happens is my neck taps my shoulder and says, buddy, you better do something pretty quick because the pain's coming back, because inflammation is coming back. And that's what I really like about it. I don't have any ill side effects. I can drive, I can work, I can conduct my life and really enjoy my grandkids and things like that.
Absolutely. I would certainly agree. I use cannabis frequently, but I could certainly quit anytime I wanted. It doesn't have that addiction feeling where I need to do it. I have to have it. So I think that's oftentimes a misconstrued conception.
Yeah. Well, Zach, we are really good because we don't have any more questions. So.
Well, that's a good thing. I mean, as we answered all of them.
Sure. So we're going to wrap up a little bit. Got any final comments you want to make?
One, just thanks again for having me. It's always appreciated to be considered to join you on here and provide education to the hundreds of people that are on here and helping out any way we possibly can. Cannabis, as you see here, it is only one part of the healthy lifestyle. You certainly have to also, adjust other things too in order to find out the best benefits. Similar to how cannabis provides that whole entourage effect. In order to find the best life for yourself, you also have to make sure you're taking care of yourself outside of just cannabis itself too.
Sure. And this isn't a magic wand, and it's not really fairy dust. It is something that will help you quite a bit. It is an option. Let's put it that way, especially with anxiety and stress. I have people that my family that has anxiety and stress, and cannabis has done a lot to really help them be able to cope and be able to get through, especially the last couple of years, but even before that, something that really makes a big difference. And I would say recommend that you try it. First of all, I want to thank everybody who's still with us. It's been a long webinar. It's been an hour and 50 minutes. Thank you very much for sticking around, and we much appreciate your interest in this. Please feel free to join us next week. We have cooking, which will be kind of interesting. Sherry Sicard will be coming to join Miss the Martha Stewart of Cannabis Cooking will be out there to help us quite a bit. And that should be a fascinating webinar. And I also want to thank Trulieve and Zach. Thank you very much. Your professional comments really make a big difference, and we really appreciate Trulieve getting behind there and really helping quite a bit. So we provided a lot of the emails. I know Zach put his email in the chat, and we'll provide that in the follow-up as well. Please feel free to reach out for us. We're still here to answer your questions. And by the way, everybody, Zach, thank you. Everybody, thank you very much. My moderators, or the moderators, I should say, Lee and Deja, thank you very much. You do a great job. Without you, we wouldn't make this, this wouldn't happen. So thank you very much. And I do want to give a shout out to Alyssa, the lady who actually gave us the idea of being able to put all this together. She really was the seed that really it all came from. So listen, everybody, thank you very much. Have a safe and have a great weekend. And Zach, thanks a lot. Enjoy.
Thank you, Mark. Have a great day.
Bye now.
Bye.